This is the second episode of TruDoc podcast series. I'm Dr. Turk. I'm the Chief Medical Officer of TruDoc. I have today the great Dr. Mahamadu Maida, the Chief of Inpatient Medicine at Johns Hopkins Aramco Hospital. It's a pleasure to have you, Dr. Maida.
Thank you so much.
Thank you for your time. Thank you for coming all the way.
Always a pleasure.
Thank you so much. So
Thank you.
After, I think, 1 year or maybe a little bit more of working together on setting up what could be the largest hospital at home program in the region, I think we have learned a lot, and we have seen a lot of different cases, use cases, and with the focus of making this more and more about the patient. I think there was a lot of learnings that I was hoping that you could share some more with us today.
Yeah, thank you so much, Dr. Tarek. You and I have gone a long way, and we've got the chance to actually interact and do a lot of things together in terms of patient care and going through a lot of different issues, ups and downs. And as you know, in medicine, you can do a lot of tabletop talk, but never ever do the whole thing, We've spent a lot of time drilling down into a lot of these things, but every time you do that, you're still going to find issues and find ways to be able to address them as you go along. And it has been a pleasure, actually. You've come with so much knowledge and understanding of what we call now hospital home, and it is definitely a learning experience for me as well.
Oh, thank you so much.
Absolutely.
And Dr. Maida, we have done different types of what we call the hospital at home programs or the virtual ward in some regions. And we have done different types, and we have served different populations of patients. And in your perspective, and applying this on your patient that you see on a daily basis, who do you think the population of patients who could benefit the most out of this program from a clinical perspective?
So we have had quite a few different, a diverse population of patients in our hospital. The majority of the patients that we've enrolled so far are patients who have had infectious diseases that require IV antibiotics, the bulk of which are urinary tract infections. We've had patients that require IV hydration. We've had patients that require some sort of lab and radiologic follow-ups that would otherwise have been kept in the hospital. But we realized that if we keep them in the hospital, it's only unnecessarily prolonging their stay when they can get better quickly at home. And so we decided that since this is a safe way of doing it and having a good selection criteria, why not? And it turned out to be quite actually a good thing for a lot of our patients.
Of all the patients that we have seen, whether it's acute patients, chronic patients, and as you mentioned, I think in our collaboration, maybe infectious diseases was the champion of what we have done, and there are different other populations such as chronic patients, long-term care patients, some different and specific types or subtypes of the hospital at home or the virtual ward, such as admission diversion, etc., etc. For every patient, sometimes it's different. I don't know from your perspective.
It is actually. Like I said, infectious diseases are the main thing so far.
Yes.
Now, whether that changes down the line, I have no way of knowing, obviously, right? But one of the things that we are identifying as we go along is that we're finding more and more patients requiring other modalities of care in the hospital at home setup. Sometimes patients are ready to go home, completely taken care of. They complete their antibiotics. You get them up to walk and show that they can do well at home, only to find out their legs become butter. They are melting under the weight of the patient and end up requiring physical therapy. And so it's one of those areas that we didn't expect we're going to have a lot of traction, and it turns out to be one of the areas that we actually need. So things like physical therapy, it's actually gaining ground, in my opinion, and I think there is room for that. Some of the other chronic conditions that I think we need to pay attention to a little bit more, patients with multiple chronic comorbidities that end up accumulating into bringing them back more and more into the hospital setting. If we're able to have measures that can hopefully control those conditions and monitor them closely, they would hopefully be able to stay more at home than instead of them coming back to the hospital.
And from a patient perspective, I think you and I have heard from lots of patients who've been through the program, and we heard a lot of good, a lot of concerns sometimes, and we have addressed those concerns as we went forward. But what is the differentiator for the patient? Why do you think this program could make a difference for these patients being at home and receiving the hospital level care at their home?
So there's been actually a few studies that shows that, first of all, hospital at home is a safe and convenient way of delivering care, hospital level care, in fact, in the home setting, And so some of our patients, I visited one of the patients who actually raved a lot about the fact that he has physicians coming to his house and actually taking good care of him. And he was very eager to talk about it.
Yes.
So I believe that this is something that is here to stay. I think it's only going to catch on, and more hospitals around the world are going to get involved with doing this type of initiative to ensure that their patients get all around care irrespective of where they are. And I believe there's going to be more improvement in the way the delivery happens, from nursing to physical therapy to all the other entities like mental health and stuff like that. So there's just so many things that I believe will continue to grow as we grow along with it,
Agreed. Yeah. And to your point, I think there have been a lot of studies in the literature on the different quality of life of patients compared between the regular hospital setting while being at home, surrounded by their loved ones, sitting amongst their family, eating the food that they're used to, having that emotional support of their entire support system, which is basically the family, which is the most important support system in the world, I believe, at least. So we have seen
and there is evidence, in fact, that is the case.
Yes.
The social determinants of health are there for a reason, right?
Yeah.
When you have issues that are pertinent to patients that you don't really ask them about and whatnot, you wouldn't know what bothers them and why they're not getting better in the hospital, simply because they have pets at home, for instance.
Yeah.
And having the pet around or another loved one at home that can actually enhance healing in some sense for some of these patients, or for maybe even most of the patients. And in my opinion, all these things cumulatively do help the patients get better quicker. And the patients themselves, according to a recent JAMA article, which was published not too long ago, it really talks about that, how it's convenient to the patient, how the patients feel satisfied, they feel it's safe, and works better for the patients in ways that can allow them to become what they feel is the best thing for them. Not what we feel about that for them. They themselves think that this is something very helpful to them.
Absolutely. And I also think that the great world that we're living in today, with all the technology enablement, that we have today, and the advances in telemonitoring and the advances in all of the devices that we're using on a daily basis, that is maybe making the experience a little bit better for doctors and for patients themselves as well. So I don't know, what is your experience with the telemonitoring features and that part of having a virtual ward or a hospital at home program?
Yeah. So the ability to monitor patients' vital signs is key. It's called vital signs for a reason, right?
Yeah.
They are important to ensure patients are alive and doing okay. When the monitoring of a particular vital, let's say blood pressure, goes high or comes low, goes down, it reflects something is happening. And so the measuring it, even if it's from a distance, you're able to tell that an intervention is needed, let's act on it, And so things like this actually do help and make patients feel safer. The fact that somebody's watching at all times and helping them to recover makes things easier for them and accept the idea of a virtual ward or hospital at home.
Working with you for a little bit more than 1 year, one thing that I know about you and myself is that we push boundaries. And I'm going to push one now.
Yes,
and I'm going to ask a risky question.
No problem.
And I know this is a question that we have asked ourselves and we have asked our fellow clinicians. From a clinician perspective, as a clinician, do you think healthcare professionals in a hospital setting would feel that they are losing these patients to a hospital at home session? Do they feel that if a patient is not sitting with them and under their care in the hospital, then that patient is somewhere else? Or do you feel that it's a continuity of care? What do you think?
What do I think about that? You know, one thing I can tell you is I had that reservation at the beginning of the program. You know, when we first started talking about hospital at home or virtual ward at the time, one of the things I was thinking about is what happens if I give all my patients out to somebody else, and then now I'm sitting down. What would happen to me? But I'm getting to the understanding that, what is important is not about me or my team per se. Yes, we want to continue to have a job, no question about that. I believe that there is room for everyone, and in this particular case, we're more concerned about what happens to the patient.
Yes.
Is this something that the patient will be interested in? If it makes the patient happy to be able to get the right care that they deserve, I'm willing to give up my job for them to be happy, and then have what makes them happy and what makes them heal quicker and all that. Why do I say this? Look, the core of what I do is ensuring that my patients get the best care that they deserve.
Yeah.
Whatever it takes for them to get to that level, I can live with that. It means that I can go home and sleep knowing that I have done what my calling is all about. It's not about me, it's about them. And what makes me happy is to ensure that they get the best that they deserve.
I highly respect and I highly understand and I highly appreciate that. And I'm 100% sure that with everything that we're doing, nobody is going to lose their job. It's only going to extend more and more.
If it happens, it happens. Because remember, look, healthcare is a calling. If you don't believe that you are there to help the patient, I think you are in the wrong place.
Agreed.
At the end of the day, for me, I think being in healthcare has been a blessing.
Yeah.
I don't know why I'm in healthcare, but one thing I know for sure is I can do something for someone else. That always makes me happy. Because at the end of the day, there's nothing in it that I can say, oh, this is all about me and not about it. It's just about the patient, really.
It's about the patient.
At the end of the day, that's what it's all about.
It's a continuity of care, as you and I always say.
We talk about that a lot of times, saying that, 100%. Look, we're moving the patient from one system to another, but that system is continuous and it goes full circle when they come back to the hospital through either outpatient care or whatever, only to go back home again. So our goal is to ensure that they get the care that they need, which is what we are here to do.
I couldn't agree more. And I believe that this is the art of care delivery, right? For everything that we do, whether it's home care, hospital at home, virtual care, at hospital care, wherever it is, inpatient, outpatient, it's all a continued journey where the patient is the center of everything that we're doing.
Absolutely.
Thank you so much.
Thank you
Always
so much.
A pleasure.
This has been a wonderful experience.
Thank you.
I just wanted to take the time to say thank you for everything that you do. You have been a pleasure to work with, and your team has been amazing. I think we'll continue to have a long-term engagement with our patients and do what we can to ensure that our patients get the best out of everything that we're doing.
Highly appreciate it. Thank you so much.
Take care.
Thank you. Thank you so much, everyone. We'll see you again in next episodes. Take care.